Good morning, Peyton. What brings you in to see me today?
Well, Bob, this morning I woke up with severe pain on the right side of my scrotum.
Can you tell me a bit more about your pain? Have you noticed that your testicle was swollen, or were you just experiencing pain?
Well, now that you mention it, Bob, my right testicle is rather swollen and I have been nauseous all morning.
Is this the first time you have felt this sort of pain, or have you experienced this in the past as well? Also, is there any family history of this sort of pain?
Well, to be honest, this isn't the sort of conversation we normally have over the dinner table, but I can't recall my brother or father ever complaining of this. This is certainly the first time I have had this excruciating pain in my whole life.
Do you remember having something called epididymitis, or appendage torsion in your past?
Well, now that you mention it, I had a brief episode of similar pain, but it only lasted a few minutes about a month ago. I didn't think much of it.
Okay, have you had any recent trauma to the pubic area?
No, I haven't.
You appear to be very athletic. Had you done any strenuous exercise prior to the onset of this pain, or was it just spontaneous?
Why, thank you for noticing. I am training for a 100-mile bike ride and went my longest training ride yet late last night. Are you thinking my bike could have done this to me?
It may have, but let me ask you a few more questions before we assume. Is your testicle discolored? As in deep blue or black? Are you experiencing any discharge from your penis, pain upon urination, fever or redness in that area?
My testy definitely does not look right. No, I have not had any pain when using the restroom, nor have I noticed any discharge, but my right testicle is more red than usual. I have not checked my temperature, but I don't feel like I have a fever this morning.
Have you felt any lumps in your testicle?
No, I have not.
Well, Peyton, let me get a few things answered to get a better understanding, and then we can work on resolving your issue. Are you taking any prescription medications, any over-the-counter drugs, or any nutritional supplements?
No, I am not taking any prescription medicine, but I did take an aspirin this morning for the pain. I don't take any nutritional supplements either.
Do you have any allergies?
No, I do not.
Have you had any surgeries or been hospitalized?
None that I can remember. I have tried to be as healthy and cautious as I can.
Have you recently traveled outside of the country?
No, I have not.
What do you do for a living? Are you married?
I am a construction worker. No, I am not married.
Do you smoke or drink? Also, tell me about your activity level during the day.
I don't smoke and I have 2 or 3 beers a night after work. I am always active during the day due to my job, and I like to work out when I can find the time.
After doing an expedited review of systems physical exam, I have documented all systems not pertaining to the genital area are unremarkable, the vitals are normal, and therefore I focused the remainder of my exam on his chief complaint. I have a very high suspicion for testicular torsion. This is a condition in which the testes and spermatic cord contort within the tunica vaginalis, a protective membrane surrounding the testes that is housed in the scrotum. This is not a common condition but often occurs after vigorous exercise, and bicycling is one of the main causes. My differential diagnosis also includes epididymitis, orchitis, varicocele, epididymal cyst, hydrocele, a hernia or testicular cancer. After performing my focused exam on Peyton's testicle, I noted moderate right testicular tenderness, along with edema and mild cyanosis. The cmasteric reflex was negative and a normal O was obtained. We have drawn blood for a CBC and CMP. I have put in a consult to general surgery and I am waiting to hear back from them. In the meantime, I have given Peyton 4 milligrams of Spra and sublingual for his nausea, as well as 10 milligrams of morphine IV for the pain. Depending on the surgeon's decision, the patient may be taken in for manual detorsion attempts or surgical exploration, most likely following a scrotal ultrasound.
Thank you so much, Bob. Maybe I need to find a less dangerous sport.